right. Good morning. Good morning. And
Good
welcome,
morning.
Dr. Edwards.
Good morning, Greg.
All
It's
right.
great to see you, and thanks for the invitation to speak today.
Yeah, it's Chase, it's a very interesting topic when we talk about menopause. I mean, this is one that we have done roughly about 5 or 6 episodes tailored for life, and we call it you know, move your ass and your mind will follow. Right?
Okay.
You got to get off your butt and do something. And prior to getting into the subject of the day of women's health, and especially as it relates to menopause, I want Chase, if you can do a brief introduction of Dr. Edwards. I think that you are a wealth of knowledge, and I want to give you credit for your journey.
Okay, thank you.
All right, Chase.
Yes. Hello, everybody. Today we're here with Miss Colette Edwards. She's graduated from Harvard University, a very, very prestigious college. She also has been working in the medical field for some time. If you guys don't know, she has a book out that you guys can go and read, and I'm looking for the title of it, but it's Navigating Your Healthcare Journey, Getting the Care You Need and Deserve. Um, like I said, she's been a really big professional in the medical field. She has been, the chief medical officer of different organizations and things of that nature. And today we're here to speak on her new startup and her work with menopause and helping women, sort of deal with this and work with this stage in their life. And so if Miss Edwards would like to, expand on positive health and her other work, we would really appreciate that.
Okay.
That's great. Thanks. And like I say, Dr. Edwards, it's been a while. I think it's for you and I, it was 2011, attending the Maryland University of Integrated Health. I mean, amazing. What's that, 2011? Now this is 2024. But the good
It's
thing,
hard to believe.
we have kept in touch, and your work that you're doing is amazing. I review your work, and some of the work I pass on to others. So that's great news, and especially during the COVID era, you was right on point, giving information, creating that awareness about how to prevent COVID and mitigate some of the concerns that we have. And that's a big thing. And I applaud you for what you're doing and the work that you're doing. And this subject here, as I mainly, the work that we do primarily centers around, I would say 95% of our clients or participants are females. And especially going from anywhere from 25 and on up into baby boomer era. And that's where, the questions come to me, hot flashes, sweating at night. What do I do about this, Greg? And I'm looking like, hey, I'm not the medical doctor, but they say, well, you know everything. I said, no, I don't know everything. I know how to read and do research, but, and I had a client once, I was training her for a 50-mile race, the JFK 50 mile. And
Okay.
the biggest challenge she had is when she showed up in the morning for training preparation, she looked like she's been at a bar all night. I say, well,
Yep.
what's going on? And then she shared with us because of, she couldn't sleep,
Yep.
sweating at night, chills and things of this nature. So this is something that Dale, in fact, a few of my nurse health coaches have mentioned to me about, yeah, Greg, if you can do something on women's health, the cycle of life, we would love to participate on. And it just so happened that you showed up on the radar screen saying, hey, I've got this and I like to push it out there and increase awareness, and especially amongst people, women of color. I know that menopause affects all women, but the fact that there's some disparities when you talk about women of color. And so I'm going to let you have it. I know you're going to talk about women's well-being, longevity, the vital lifespan, health span, and the reproductive age. And so I'm going to get out of the scene, sit back, and let you educate our audience on what this means when you talk about that journey of menopause.
Okay, will do. And if you have questions along the way, because I don't want this to just be kind of a lecture scenario for people. But I think probably a good place to start would be with the basics of what actually is menopause. So menopause is defined as the day, and it's just a day, where a woman has gone for 12 consecutive months without a period. And the time leading up to menopause is called perimenopause. And it's during that time that a lot of the symptoms that people think about in terms of the hot flashes, the night sweats begin. The time after that day is postmenopause. Now, if you are someone who entered menopause prior to the age of 40, that's called premature menopause. And if you go into menopause between the age of 40, but younger than 45, that's called early menopause. But most people, you're talking a time frame of 45 to 55 before they hit that day of going the 12 consecutive months. Obviously, that's different if you have had surgery to remove your ovaries. So that's something that in that situation, you could go into it overnight. And it has also been found that even if you have a hysterectomy, for some people, that affects their ovaries enough that they may still go into menopause early. And I bring that up because Black women are much more likely to have fibroids, and they're much more likely to have a hysterectomy recommended than be told about and offered potential options that would not mean removal of their uterus. And then in terms of some of the symptoms that people see, as you had mentioned, hot flashes, night sweats, the issues with sleep are the ones that immediately come to mind, but some others include brain fog, where people have difficulty focusing, concentrating. They have memory lapses. They may, because of the sleep issues that develop as a result of the hot flashes and night sweats, then they have problems with sleep, which then means the next day they may be completely fatigued and result in what you described with your client. Additional symptoms, and a big complaint for women has to do with weight gain. And some of that is related to changes in metabolism just as we're getting older. And some of it is related to menopause and the hormonal changes that happen. And the hormonal changes involve primarily a big drop in estrogen levels, as well as a drop in progesterone levels. Women can also have issues with mood swings. The perimenopausal period is one where their periods may change and become very irregular. They may have heavy bleeding. They may have lighter periods. It may be all over the map. Some women experience joint aches, muscle pain. Some people notice changes in their hair in terms of hair loss, in terms of change in their hair texture, in terms of their hair being drier. Some women can suffer from something that's called the genitourinary syndrome of menopause, and that involves a constellation of potential symptoms.
Yeah.
So you may notice
Let me stop you and interject for a second. I mean, you covered a lot of symptoms, and that's why I think one of the reasons in my research and study that the menopause is so complex. And it's something that, in that research realm where it's predominantly of males, and this was not sexy enough for them to study. And so, and because of the complexity of what's happening in the menopause cycle that they refuse to do research on it. And so one of the things you mentioned, I know that you talked about the fibrosis tumors, and I had a lot of clients that talk about that and swelling and stuff like that, and have difficulty time doing sexual intercourses with the fibroids there, and also the removal of uterus. Is that more common amongst women of color due to the lack of treatments options available to them?
So I would say yes, that Black women have a much higher rate of fibroids. And when they do have fibroids that become symptomatic enough to require treatment. So for example, if their fibroids are leading to very severe pain, or if their fibroids are leading to enough bleeding that they become anemic, then it's much more common for Black women and other women of color to have a hysterectomy as the recommendation, as opposed to other approaches that would not involve the removal of the uterus. So some people are never aware. And if you don't do some research on your own, you may not be made aware of other potential options that may be effective and wouldn't require removal of your uterus.
And that's a good point. And I think that this renewed interest on women's health, I mean, you're right in time. And I think one of the things that I was thinking about in the state of Maryland and elsewhere, you know, as a lot of funding being made available for maternal health. And one of the things I see in this disparity amongst maternal health, and I'm saying, well, it doesn't make any sense if you look at providing funding, resource of funding to support maternal health. And I say, well, wait a minute, you haven't addressed those factors that could prevent a woman of color from having a healthy baby, such as what we call the social determinants of health, you know, providing adequate transportation for that female to get to a healthcare provider, providing fresh fruits and vegetables in the neighborhood, making the neighborhood safe, or providing access to the health care she needs to deliver a healthy baby. And so I say it doesn't make sense. And so we're not looking at a systematic approach to addressing the women's health, and especially that life cycle of pregnancy. But on the other hand, when we talk about menopause and going into that stage, now you're looking at a whole ball game. And what I have seen or noticed, that your diet and health also play a part in whether or not you go into menopause earlier or late in life. And so that's something, could you elaborate on that? Because
Sure.
we're finding out a lot of younger women going into menopause. And later on in life, they find out with all these health complications because of the lack of the estrogen.
So first of all, and I'm glad that you brought it up in terms of the research that has been done in the entire arena as it relates to women's health is woefully inadequate historically, and it continues, although it certainly is getting better, it still is woefully inadequate. And so in general, a lot of what we know, have learned, used to create guidelines, used to develop medication, has been based on a very small, proportionally speaking, part and segment of the population. So much more of a focus on white men, and white men of a certain age even. And then for everyone else, an extrapolation, assuming that everyone else will respond in a similar way and that things may unfold in the same way, which sometimes has been the case and sometimes has not been the case at all, even when you look at men with regard to a particular condition. In terms of the importance of a healthy lifestyle and addressing those social determinants of health, that is something that is, and I can't emphasize it enough, incredibly important throughout the course of your life. And the sooner that you start pursuing healthy eating and enough physical activity and managing your stress and making sure that you are not on the go constantly and that you are still staying connected to your friends and your family, the better off you will be just in terms of your life at any given point, as well as for the years that lie ahead. And in fact, you find that in some instances, living that healthy lifestyle will help a woman who is on the menopause journey in terms of her symptoms. It also means that if you have not been really focusing on yourself, because so often it's the case that women are focusing on everyone else, but not their own health, that this is the perfect time to get started if you haven't done it already, because like I said, it could help in terms of your symptoms, but also because during the menopause journey, those hormonal changes massively increase the risk of a host of chronic conditions. And it's physical conditions like heart disease, stroke, diabetes, high cholesterol, but it's also conditions like anxiety and depression. And if you already have any of those conditions, you could potentially either have something triggered, like a depressive episode, or it could become more difficult, for example, to manage your diabetes. And it's also the case, I liken menopause to COVID from the standpoint of COVID can impact any part of your body. And with the menopause journey, because of the hormonal changes, it can impact any part of your body. So that's why you can see a multitude of symptoms well beyond what people typically think of. And therefore, it makes a difference in terms of how things can go awry if you aren't taking care of yourself, simply because of that change in the hormone levels.
So,
And
you made a point that I want to circle back around and talk about when you talk about some of the symptoms of anxiety, depression, mood swings. And I'm just wondering if those types of symptoms can be misinterpreted as a mental issue. I mean, right now you see where everybody, this mental issue is the thing.
right.
And I keep saying that, is it real? If little Johnny or little Mary, in this case, little Mary, if she comes to me and I diagnose her and if she's a threat to herself, and the question is no, is she a threat to others? And the question is no, then maybe there needs to be some basically counseling advice of taking the approach of a psychiatric treatment. And so I'm just wondering if some of the symptoms that you described, such as anxiety, mood swings, and stuff like that, can be misinterpreted as mental health issues and being a misdiagnosed. And so even though I'm going through that menopause cycle and unaware of it because I haven't done my personal research, and I'm thinking, oh, what's happening is I got a mental problem because everybody is talking about it.
I'm so glad you brought that up. It was like you laid it up for me perfectly.
Right.
So I would say that one of the things that happens is that because perimenopausal symptoms start much earlier than people think. I think most people are thinking, oh, that'll be something in my 50s, but the symptoms really start in your 40s for most people. And because, like I said, the hormonal changes impact your entire body and can be manifest in many ways, you can have symptoms that if you don't have hot flashes and night sweats, which I think would be like a red light going off, like pay attention, this could be menopause. If you're having other things like, oh, I can't sleep, oh, I'm gaining weight, Oh, I'm having more frequent urinary tract infections. Oh, I'm getting achy. Oh, I'm having palpitations. You can see how it would be very easy. Someone shows up with palpitations. And if the woman is not thinking this could be related to the menopause journey, and the physician is not thinking that way, you can easily see how that then becomes an EKG, a stress test, an echo, the cardiology referral, and how a person could twirl around in the system for a very long time and have everything found to be normal, and then you still don't have an answer. And there are definitely going to be times when people have complaints that they need to have the standard workups done. But there are other times that if you are not thinking it possibly could be the case, then it is to the detriment of the person, the system, the out-of-pocket costs. So, for example, if you are experiencing, let's say, anxiety or depressive symptoms, out of the blue, you've never had them before, then it could be that you are anxious. It could be that you do have depression, but it could just be related to the fact that your hormones are all over the place. And the thing that's going to help you most is actually going to be hormone therapy, as opposed to being put on an anti-anxiety medication or an antidepressant. So that would need to be a potential consideration. Now, not everyone can use hormone therapy, but for those people who can, it needs to be in the mix of potential possibilities, because if it's really related to the hormonal changes, then some of the other medications either aren't going to resolve the problem, or they aren't going to be as effective as people might think that they should be.
Okay. So tell me, I think we got roughly about 10 minutes left, and I want to talk about you as being the chief medical officer for positive health and focus on women. And what are you doing to address this, and especially amongst women of color? I know that there's a hormone, what is HRT treatment therapy? What's that R? Replacement therapy, hormone replacement therapy is out there as one recommendation. But as an organization, as a founder of an organization that focus on menopause, what do you recommend? Give our audience something that they can subscribe that says, we want to talk to Dr. Edwards to find more about what she does. And before it's over, I want you to give an email or phone number where people can contact you directly. All right, but give us some of the ideas what you're doing to address this disparity amongst women of color.
So I will say, just on the topic of the disparity, on average, and it can vary from race to race, it can also vary even within a race. Different ethnicities may have different experiences. But on average, women of color tend to have the onset of menopause at an earlier age, which means all those risks that I talked about with regard to chronic conditions begin earlier, which means the healthy lifestyle, et cetera, becomes even more important and needs to happen sooner. With regard to what we are doing at Positive Health right now, it is a pilot program that is based on market research that was done. And the idea is that it would be a one-stop shopping kind of experience. So women have access to education via blog articles on a website. We have webinars on a regular basis. We have a podcast. We have a newsletter. So that's one part of our education. We also have 14 different content tracks where people can pick what's of most interest to them. And some of them may be on brain health or emotional well-being, but we also have tracks for women of color, as well as those who are members of the LGBTQIA+ community. So if you are a Black woman or you want to learn more about what the experience would be as a Black woman and educate yourself, that's one of the content tracks that you can pick, because every one of these journeys is unique. And then when you compare across groups of people, there can be differences as well. So people will get text messages delivered based on their interests. We also
when you go any further, can you cite your website and a contact number.
So the website is positive, PAUSITIVE health.com. Once again, PAUSITIVE health.com. And then if you want to send an email, it would just be info@positivehealth.com. And if you go to the website and you want to participate in the pilot program, there'll be a join button, and the programming is free. It'll run through the end of December. And the only potential cost would be if someone wanted to order at-home lab tests. That would be a decision on their own, or if they wanted to access a menopause-trained clinician. And with regard to the practitioner piece, that's something, a big message I want to leave people with, that about 70% of GYN residency programs don't have a dedicated menopause curriculum. So a lot of people, and that's for GYN, not internal medicine, not for family practice. These are the people who are the clinicians who are going to be taking care of women. So they leave unprepared and uncomfortable in terms of managing the treatment. And then you have women who may not be sure of what's going on. And so you can see how things would not be optimal, shall we say. So that's why it's important to try to find someone who has that specific expertise, who's done extra training, et cetera. Try to find that person to help guide you.
That's great. And I think that's great. And I'm hoping that you get a lot of responses as a result of this YouTube or Zoom conference, because I know the need is out there. And one of the things I heard you say, if they act now, it's on the pilot program, they can get in pretty much free of charge with minimum cost. So that's a good deal. So we want people to respond based on hearing the information. We will push it out there because that's a call for addressing the disparities within our community. I mean, we, in the last 6 months or something, we have been addressing the political determinants of health. And those are the things that are structured racism, the distribution of resources, as well as local people in power that prevent or preclude an organization or community or women of color from thriving, living their best life. And so what you have conveyed to us today is information that we can reach out to, even if you're not a woman, if you're male and you have a wife, if you have a daughter, a sister, a grandmother, anybody can use this type of services addressing the menopause and how to prolong life, live a healthy lifestyle by addressing these things in your lifestyle. Then I would encourage you to reach out to Dr. Edwards on information she provided. Trace, do you have anything, any comments?
Yeah, I just wanted to say thank you for coming in today and speaking on your company and elaborating on the different work you're doing to help women with these issues and help them through these these struggles that they're having in that cycle of life. I did have one question before we finished, was that when women are going through menopause and they're going through all these different struggles, would that affect their ability to work or their ability to, I don't know, let's say maybe raise children or things of that nature that they may have had obligations to before they started going through these bodily changes?
So that's an excellent question, and it definitely does impact women on a daily basis. Up to 80% of people are going to have symptoms of one sort or another. The severity of that can be highly variable, from people who have minimal symptoms, which is a very small percentage of the population, to people whose symptoms are so severe that they literally have to cut back to part-time or have to leave their work altogether. You have people who may not be working as effectively, or they may be working effectively, but not up to their own standards compared to the way things were in the past. So just think about it. If you are sleep deprived, your workday is going to be very, very different than someone who has been sleeping well. And if your family obligations, to your point, they don't vanish just because now you're going through this stage of life. You still have to deal with all of that. I think it's important for people to try to garner and help educate the people around them, to let them know that this is going on, and that there are days when they just aren't going to be up to some of the things they may have been up to in the past. And they may get irritated about things that would never have bothered them in the past, because having that support and understanding and patience can obviously make a big, big difference. But that is a very important point. In some of the surveys that have been done, about 20% of women have said that they have thought about leaving their job or have actually left their job. The other thing that is happening is that the typical age when this is happening is often a time when women their career is just beginning to really, really take off, and the promotions are happening, moving to more senior positions, et cetera. And there are some women who will actually take themselves out of the process because they will feel, particularly if they don't understand what's going on, and that there are many options, hormonal and non-hormonal, that can help them with their symptoms. They'll say, they have the brain fog. How can I possibly take on more responsibilities? How can I, et cetera? So they take themselves out in advance of, instead of seeking help and finding the combination of things that is really going to help them control their symptoms. So that's an excellent question. And in fact, in the UK, which is much further along than the US in acknowledging this stage of life and doing something about it, the driver for them to really take this more seriously is that they lost 1 million women from their workforce.
Good. That's great. So, that's great. I mean, you're giving a wealth of information, and apology, we're running short on time. So any last minute comments? We have your website, we have your contact information, and I want to invite you back to do a follow-up on this, because this is something that we cannot afford to just rush through. I think we need something where we can give more detailed information, and that's where the program that you have developed will support women in need of those types of services, especially going through menopause, because we don't want a woman thriving in life and all of a sudden hit a plateau and decide that she has to choose between her health issues going on and career promotion and things of that nature, as you just elaborated on. So again, Dr. Edwards, I thank you for your time, your energy, and the work you're doing, and look forward to talking to you again.
And I can't thank you enough for all of your support. And thank you, Chase, for excellent questions, and look forward to having the opportunity to do this again, because this is really, really important to me. There's so many people out there who are suffering in silence, and it just does not have to be that way. There are things there's help out there, and there are things that they can do to help themselves. So
sounds good.
We should help, and let's get started.
All right, folks, you heard it live from Dr. Edwards. Please contact her once again from Tailored for Life, bringing it to you. Thank you
so much.
Thank you.
Okay.
Bye.